about that. I know I still feel like it's morning. Hey Marcus, what's good? D Chambers, how are you? Where's Brooklyn at? so I want to make sure we get some experts on the line right now so that you guys can get some great information about Black Maternal Health Week. And what it is Black moms are so affected way more than anybody. I think they're 3 or 4 more times likely to die giving birth. So we want to talk about that disparity. And yes, what's up, y'all? All right, so let me see if I can add Coach Jesse. Health first. This is my first time having like multiple people on, so you guys know. So let's see how this works. What's up, AD Dolphin, my guy? Hey, Coach Jesse.
Hey, beautiful.
Hold on, let me pin this
Yes, yes.
thing. Of course, I gotta ask you that always.
Rashi.
Hey, Rashi, how are you? Can you hear us? Hold
Do
on,
you hear us, Rashi?
I can hear you.
Awesome.
Okay, and then I'm adding Charles.
Yes.
It is. This is my first
We did it.
Look, y'all are some
study on
experts. Look at this. Y'all listen, I'm learning. Hey, everybody. Angela, thank you for having us.
it. No, thanks for being here. Listen, I have my tech person, Dad, here just in case things didn't work out, but I didn't even need her.
Yeah, this is all of our first time doing this multiple thing. So go us.
Yeah, like a beautiful brown. What's the show that used to have all the kids in the window? Um,
The Brady Bunch?
Brady Bunch. Yeah, you got Brady Bunch vibes going on.
That's it.
Melanin.
So I want to just get started and kind of do an introduction of what we're talking about today because it is Black Maternal Health Week. Coach Jesse always puts me on to everything that's happening that I have to make sure that I'm on top of. So, Jesse, I would love for you to kind of intro everything, and then I'm going to ask some questions and take some from people watching.
Excellent. So thank you so much for having the conversation. As you said, it is Black Maternal Health Week, and actually there was a proclamation by Vice President Kamala Harris yesterday. Charles, you posted about it with Black Mamas Matter. Their work for the first ever proclamation yesterday done from the White House, and there was a round table and of Black mothers and sharing the stories because it is a crisis. I mean, Black women are, as you said, 3 to 4 times more likely to die in and post childbirth as well than the national average than white women. And then also in our city, Angela, it's actually up to 12 times, okay, which is insane. And then another layer is that the CDC just released a report last week, right, Charles, that actually the numbers heading into COVID surged by up to 15%. Now, worse than what it was. So can you imagine what it's going to be like when they take the numbers of what it was like during COVID? Insane. So, my story, I deal with, I'm one of the Black women who experienced fibroids, 90% of Black women by age of 50. And can't believe I'm actually going to be 50 this year. and unfortunately, it causes us to even more disproportionately have negative outcomes, more complications. My story, as you know, is full of what we call in Black maternal health near misses. And I'm grateful that I am alive, but unfortunately, so many of us, we have to mourn so many of our sisters. And such as Kira Johnson, Charles' wife, who we say her name today, along with so many others. So I said it had to happen today. We had to have this conversation because there's too many lives, too important.
Since you brought up Kira, Charles, if you don't mind, share your story and why this is important to you.
Yeah, absolutely. And I just want to reiterate is how grateful I am in having this discussion. And to Coach Jesse, my sister, for just being the relentless warrior that you are. So, in the interest of time, I'll just try and keep it brief. But I was fortunate enough, Angela, to meet a woman that absolutely changed my life, right? When we talk about my wife, Kira, we're talking about a woman who raced cars, who was a skydiver, who had her pilot's license, who spoke 5 languages fluently. And me, I always wanted to be a dad, right? I'm just an overgrown kid, and I always wanted to be a dad. And so we welcomed our first son in 2014, Charles V. And we had always just prayed and talked about how amazing it would be to have these 2 back-to-back boys. So in April of 2016, we're expecting our second son, Langston. And it's important to understand, as I share with you Kira's story, that throughout Kira's entire pregnancy, not only was she in good health, she was in exceptional health. Every prenatal visit, every examination, all signs pointed to both her and our new baby being both extremely healthy. And the painful irony of what I'm going to share with our audience today is that as a father, as a husband, you want the best for your family. And so we made the decision to deliver at Cedars-Sinai Hospital in Los Angeles because we thought that that was the best place, right? It had this amazing reputation for being this place that was on the cutting edge of maternal wellness and all this crap, right? And so on April 12th of 2016, we walked into Cedars-Sinai Hospital in Los Angeles, what we expected to be the happiest day of our lives, Angela, and walked straight into a nightmare, okay? So Langston was born from a routine scheduled C-section at our doctor's advice, very importantly. Born perfectly healthy, 10 fingers, 10 toes, this amazing, beautiful baby boy. Shortly after delivery, they take us back to recovery. So we're on top of the world, right? This is it. Everything we prayed for, everything we hoped for, it was finally here. And after being back in recovery for about an hour, I began to notice blood coming from Kira's Foley catheter at her bedside, right? For those of you who are familiar, that's, you know, what they use at post-surgery to help you recover. And I began to notice blood.
She had an epidural, so like they actually
right.
put your lower half to sleep.
So I noticed the blood. I bring it to the attention of the doctors and the nurses. They come in, they examine her, they check her signs, they physically, you know, look at what's going on. And over the next 10 hours, the most ridiculous, outrageous case of deny and denial just happened. We begged and pleaded for more than 10 hours for the staff in Cedars-Sinai to take action. All of Kira's concerns were dismissed as not that big of a deal. They said that they were going to take tests that never came. They said they might take her back for surgery. When we asked for answers, we were just dismissed until they finally took her back to surgery after allowing her to bleed and suffer needlessly for more than 10 hours. It was far too late. When they took her back to surgery, Angela, there were more than 3.5 liters of blood in her abdomen from where she'd been allowed to bleed and suffer needlessly for more than 10 hours. And when they opened her up, her heart stopped immediately. And so for me, when I walked in that hospital that afternoon, the fact that my wife would not walk out to raise her sons, it never crossed my mind. But as time moved forward, that's when I get into the research for myself, and I became to understand what we all on this call know today is that we are in the midst of a maternal mortality crisis that is not only shameful domestically, but shameful globally. Right now, we rank first in the world in maternal deaths, right? In addition, we spend the most money on maternal care. So right now in the United States, that means that it's the most dangerous place in the world and the most expensive place to give birth. And additionally, as you mentioned, our sisters are dying in many instances across the board nationally 4 to 5 times as often, and in some instances, like in New York, 12 times as often as their Caucasian counterparts. So I'm extremely proud to be here with you all doing Black Maternal Health Week because we have a lot of work to do.
And Charles, I do want to say, you know, yesterday was the anniversary.
Yeah.
And, you know, I pray for you all the time. I send you these text messages because the fact that you're doing this work, you know, the fact that you're doing this work, it happened Black Maternal Health Week, right? Like what became Black Maternal Health Week.
Yeah.
And you're doing this work and having to grieve and relive it every time. We can't thank you enough for the sacrifice. And it was, you know, it was Langston's 5th birthday on Monday, which, you know, but we know that Kira is very, very proud and looking down on the work that you're doing.
Thank you so much, Jesse. I appreciate it.
Mm-hmm. Do you want to talk about the Kira Johnson Act, maybe?
I'm happy to. if I don't know if Angela had another question, but
Oh no, to say thank you so much for the work that you are doing. I know at the same time, like Jesse said, having to relive that is not an easy thing at all. So we appreciate you
thank you.
for making sure that you spread awareness. So yes, please continue.
Sure. And so, so for me, Angela, like when all this happened, of course, my life was turned upside down. And I didn't know what I was going to do, but I felt like I had to do something, right? I felt like I owed it to my sons. I felt like I owed it to Kira, um, to try and make an impact and to try and keep our nightmare from becoming the reality for other families. And so I began to advocate. And so in 2018, we passed the first ever federal piece of legislation to prevent mothers from dying in childbirth, the Preventing Maternal Deaths Act. But that was a first step, and it was an important first step, but it was just that, a first step. So I'm extremely proud to share that 6 weeks ago, we went back to Congress under the leadership of Representative Alma Adams and Lauren Underwood, who lead the Black Maternal Health Caucus in Congress, to introduce a monumental piece of legislation. Now, I'm from the South. I grew up in Atlanta, so this is what the old folks say. This is the shouting news, right?
That's
So
right.
this is shouting news, right? And so we introduced a bill, Angela, that is not one, not two, not three, but 12 pieces of comprehensive legislation specifically addressing the Black maternal health crisis in the African American community. So within this package, there are laws that are going to address the specific needs of incarcerated mothers. I'm not sure if you're all aware, but we have outrageous instances of obstetrical violence, forced hysterectomies, rape going on inside of prison systems for women who don't have any voice. So we're going to address that. We're going to talk about social determinants of health, right? We're going to work towards expanding Medicare and Medicaid to up to a year postpartum, right, for every mother that needs it. So, there's gonna be special. There's a special bill within this package that specifically addresses the technological needs. I see my sister Kimberly Sears Allen,
Yes.
who is the founder of the Earth app,
Earth app.
an app developed for Black women by Black women for Black women to think of Yelp, but for maternal care. We're going to fund those projects, and also within this bill is the Kira Johnson Act from my late wife Kira. That is
We hear you. Are you there?
that.
There you go.
So
Kira Johnson Act. Don't lose it. Kira Johnson Act. There you are.
Oh yeah, I'm wrong. So the Kira Johnson Act, which is going to specifically work specifically towards addressing accountability measures. It's going to work towards transparency and funding for community-based, female-led organizations of color, Black female-led organizations of color. So we're talking about the foot soldiers,
like birthing centers, doulas,
birthing centers, the women that are catching the babies, not just these big organizations that have hundreds of millions of dollars in funding. We're going to get the money to the streets to the people that are actively with their hands on bellies and holding mothers' hands. And last but not least, we're going to have independent quality of care compliance offices within hospitals that are independent from hospitals. So what does that mean? If you have a concern right now, if you go in to give birth and you ask to speak to somebody in consumer or patient affairs, they work for the hospital. So they're going to take a complaint and they're going to stuff it in a drawer. What we're going to do is we're going to set up independent compliance offices within these hospitals. But dig this, Angela, then the federal government is going to publish that data. So that's going to go a long way to transparency, accountability, and making sure this gets done. So for everybody that's on, who's tuned in, I need everybody. You can go to forcure4moms.com. There we have a very, very simple, very, very easy petition. Click on the link. You can also go to my IG page, click on the link in our bio. It'll take you to the petition. In 30 seconds, you will be able to send a letter to both of your U.S. senators, Angela, as well as your local congressperson, demanding that they take action and take a stance for Black mothers in our country. So it's an exciting time, and all this has been a painful journey to be right here, right now, at this time, in the midst of the maternal health revolution. I'm blessed and extremely proud of all the work that's been done. We have a lot.
I want to touch upon a couple of things that he said, Angela, if that's okay. And we need to actually try to get Rashi back.
Yeah.
I couldn't hear you. What'd you say?
Can you hear me? Can you hear me now?
I couldn't hear Angela.
Oh, okay. I said I want to just we need to try to get Rashi back. Health first.
Um,
She got frozen. It was her signal. Can you try to add her back?
yeah, I'm trying.
Okay. In the meantime, I wanted to just piggyback on a couple of things that Charles said. Thank you so much for sharing, Charles.
Thank you.
One is that accountability is huge, right? We're talking about, you know, hospitals have world-class designations, so much that, you know, when you look at and you say, wait a minute, something's wrong, you have no one who's independent to be able to say, wait a minute, there's to have accountability, okay? To have accountability specifically for what's going on in our cases, okay? Because it is a true crisis. And then the thing about the Earth app, I want to come back to that because I love what Kimberly is doing. And I'm really pushing that app because it's a Yelp-like review so that we can actually enforce personal accountability and say, just like you go, oh, this is how they treated me. They were wonderful to women of color. I had a great experience with this doctor. I had a great experience with this pediatrician because it's also for the children's care up to like 18 months. Okay. I had a great experience with this hospital, or the opposite, right? So we can decide which ones we can now vote with our feet, vote with our choices, and we can choose to have ethnic concordance, which is finding doctors that specifically look like us. Because guess what? The statistics show that the outcomes are monumental in terms of when we have doctors that look like us caring for us. And it's also the same thing with the detriment of babies. When they have white doctors treating Black mothers and Black babies, the statistics show the disproportionate effect, right? So very critical. And that's why I was like, look, I called up Charles. I said, Charles, you don't know me, but I'm your partner right now. Right, Charles?
That's why I love you.
I said, we got to get this work done. Yes.
What when you're in the hospital and you have questions or you know something's not right and the doctors aren't responsive or being helpful?
Can I'd love to talk to, I'd love to speak to that. And I know that Jessie has a tremendous amount of lived experience with this. I think that she is such a testament to the power of advocacy, right? And how important it is for you to advocate for yourself. First and foremost, it's important if you know that you're going to be in a situation where not only you're receiving, even if it's outside of a birthing circumstance, to understand your patient's rights, okay? And even before that, it's critically important to do your best to evaluate the cultural sensitivity of your provider, right? So for mothers specifically, the first thing we want to do is end a conversation with their provider about simple question, hey, are you aware? And this is important too, because it's important not only for Black mothers to have this conversation. White mamas need to be having the same conversation. We need allyship.
It's true.
So
Hello. Say that again.
simple conversation. Are you aware of the maternal mortality crisis in this country? One. Two, and are you aware of how it's disproportionately affecting African American mothers? And three, if you're African American, what are you in your practice in this hospital doing to make sure that I'm not only going to survive but thrive before, after, and during childbirth, right? Secondarily, we have to understand our patients' rights, right? Every single hospital, every healthcare system has a patient's bill of rights. You can research online. So this is how you understand what to do specifically if you are concerned that you aren't being heard, seen, and your opinions and your concerns are not being validated, right? And then beyond that, one other thing that I'll also say that's important, if you're in a situation where you are requesting a procedure, a medication, and you are being denied, demand that they make a note of that in your chart. Make a note in your chart that, look, at 12:02, I requested a CT scan, I requested a medication, and you denied it. And see how quickly you get some results. And you do not have to be combative. You do not necessarily have to turn up, but it is important to raise your voice and be informed and empowered, because there is a response that people receive. It's unfortunate that the reality of the situation is that doctors are trained to profile people.
Right.
Are they sick? Are they this? Are they? And oftentimes that when we that can work to our advantage, but when the bias comes into the profiling and they presume a mother is, I think that she may be over exaggerating. She has higher pain tolerance because of her ethnicity. she just that and the third. When bias meets this profiling, we have catastrophic consequences, and that's what happens.
So to get to that, to going back to calling the racism on it, that's actually, you know, one of the key things that I say is my strategy is listen to your bae, right? And I'm sorry, I just got a text that she says she can't request to get back on.
Yeah,
Health First NY. You're
I
trying to add her, you can't get her, right?
Yeah, I can't.
Okay. So we tried, but we will keep she's gonna try to request again.
I'm
but
trying.
so let me go back to the strategies. Listen to your bae, BAE, okay? Because we have to do all the things. One, we have to sign the petition and share it like crazy. At 4, the number 4, Kira, Kira, 4, the number 4 moms, all right? That's Charles's website.com. We need to share it. We need to send it to all our family and friends, and we need to rally, because if you're not a mom, you have a mom, you have sisters, you have people who have moms, and all of our lives are necessary to fight for. Okay, that's number 1. Number 2, so that's what we can do politically, legislatively, because we want to get it passed from Congress to the Senate, right? And then we want it to be implemented, right? Passed overall. So that's one thing. Number 2, listen to your bae is my personal empowerment charge. Bae is BAE, right? Your body, your advocates, and your experts. This is really important because just piggyback into what Charles said, call out racism if you see it. So number 1, I skipped here, body, A and E. B is body. Listen to your body. If you have pain, something's going on, don't let somebody tell you, oh, that's normal. Okay, we hear that. I hear that with the fibroids. I hear this with women who are pregnant, right? We have a mutual friend, Angela, who was having severe pain from a fibroid in pregnancy, right? And basically it was like, oh, it's just a fibroid degenerating. She was going through severe trauma. Thank God she came to us. We were able to get her on our balance program. It put it in check, right?
That's scary. She couldn't even get out of bed. She couldn't even stand up. And
she couldn't even stand up. Okay, but we were able to help her, empower her with, we got her meal plan, the supplements with our balance program to, you know, reset the hormones, and now she is doing fantastic, which is great. But what if she didn't know, right? So it's number 1, listen to your body. Just because they say, you know, your pain tolerance is higher, then you got to call it, right? And say, okay, wait a minute, I need to find people who are going to listen to me. Part of the body also is, you know, when we look at that, prevention is the best thing we can give our body. So that's eating right for ourselves, right? That means making sure that we're doing the things to take care of, be the experts of our own health. That's why we do the work of the detox now. That's why we have the free food list and the free detox and all of the support systems, so that you can do the things that are in your power, okay? Because when it comes to it, we, as my friend Kimberly says, she says, we have to do all the things, okay, to make sure that we claim and we support our lives. The A is the advocates. Make sure that we have people like a tribe. You're having issues, you feel like maybe you're being discriminated against, follow me, follow Charles, make noise, tell us. This is, in fact, Angela, I don't know if I told you, but Charles is going to be part of my podcast, which is going to be, actually, we're going to have a segment called Detox the System, right, Charles? Where we're going to be amplifying these stories, all right, so that these stories that are marginalized and they're happening in the cracks and the crevices and nobody's giving them voice, so that we can amplify these stories so there's more accountability, and also so that it provides amplification for people who are doing the work, right? And then there's the E, the experts. You got to be the expert of your own health, all right? That means doing the research, but then also getting multiple, what do you call it? The doctor, another, I can't remember it right now.
Another opinion.
Yes, another opinion if you need to, okay? If it's not sitting well with you, don't let it just lay there. You know, our sister Amber Isaac, right? Think about her story, Charles, right here in New York. It hurts me because she actually was documenting her story, right? Charles, she was saying something is wrong. I'm getting care. Something's wrong. She died with, it was preventable. That's the biggest thing, Angela. Preventable deaths.
Can I jump in?
Preventable.
Think
Yes,
that's
yes.
important. You mentioned something that's so critical, and I know I kind of rambled off, Angela, a lot of the statistics. One of the most troubling statistics with this entire maternal mortality crisis is, in addition to all the losses that we're experiencing, the CDC has determined that more than 60% of these mothers that are dying, their cases are classified as preventable losses.
Wow.
They should be here. They should be here at the first day of kindergarten, right? They should be here celebrating birthdays. They should be here at graduations. They should be here being grandmothers and living on to just full, beautiful lives that all mothers should be entitled to, but they're being cut short. So
Yeah.
it's something. But the good news is this, and this is important. I want everybody to understand is that although these things that we are sharing with you are troubling, these stories are heartbreaking, is that there is hope. And the hope in this is that we can fix this, right?
Yes.
Not
Yes.
years down the road, not generations from now, but right now. We have the resources, we have the momentum to make a substantial change, because the reality of the situation is, if you mean to tell me we can, let me just give you some context. The cost of a
Yes.
single aircraft carrier, all right? The United States could provide doula care for every single mother in the United States that wanted it,
My
right?
goodness.
Right? And so we have to use our voices, and what we've done is we make it clear that this issue around maternal mortality, and particularly Black maternal mortality, is not a Black issue. It's not a women's issue. It is a human rights issue. That's
Absolutely.
how we have to classify this, because at bare minimum, mothers deserve to raise their children.
Children.
That should
Say
not,
it again.
right. I mean, that should not be a privilege. That is something that fundamentally in this country we can do, because it's being done everywhere else. So
And it's not just women without health care, women who are uneducated. Charles gave you the story of a hero Kira was, right?
Hmm.
And Serena Williams, celebrity, money, power. She literally almost died because they were not listening to her. She had a blood clot and she was saying something is wrong, something is wrong. If she did not have the cachet and the clout she had, would she be here today? Right? So this is not a poor people's problem. There are implications that are more. However, this is a problem we have to fix. You spoke to a number of costs. $230 billion is what the savings would be from eliminating, a study showed, health disparities for minorities. All right. $230 billion savings. $1 trillion savings in direct costs from associated with illness and premature death. Another thing I wanted to bring up, because I don't know if we're going to get Rashi back, is that there was a study done by the Philadelphia Children's Hospital of Philadelphia, and it showed that they administered both the child adult race implicit association tests, is what they were called. And out of most residents in the study had pro-white, anti-Black bias. Okay, 91% of the participants had bias against Black children and the white doctors. All right. Perfect, Rashi. You came in right now. Just talking about the children's of Philadelphia.
Lose her again.
Yes, go ahead.
Please, Rashi, go.
I'm passing over the ball for you to talk.
Thank you so much. While the technology is working in my favor, let me give you some background. Health First is an insurance company serving New York City and upstate New York, Hudson Valley, and also Long Island. We serve about 1.6 million members in this area. And we're actually sponsored by our providers, and we collaborate closely with them in understanding how we can address disparities in health equity. So a few years ago, we found it actually in our insurance data that Black women and Hispanic women were much more likely to carry a higher burden of disease entering pregnancy, and they were also less likely to get follow-up care. So we actually worked with one of our hospitals, Mount Sinai, to develop an evidence-based model of care to navigate these women after they delivered their babies, and to help them get the right follow-up care that they needed, and to also give them the right education they needed about signs and symptoms if they had diabetes, mental illness, or even hypertension, when they needed to call the doctor and get help. So they knew when to listen to their internal voices and their internal bodies and understand how to advocate for themselves. So we found through this project that we were actually able to eliminate the disparity in receipt of postpartum care. So these high-risk moms from very burdened neighborhoods were receiving postpartum care at the same rate as lower risk moms. So that was one really big success. The second success,
and they did it by incentivizing the doctors, right? That's really important.
Part of it. Part of it was a community health worker. Part of it was payment reform, making sure that there were adequate incentives around postpartum care for the doctors. And then, another part of it was educating the doctors, really talking to them about this specific population and their needs.
And the results, as you said, it changed the outcomes, and it was a pilot study that now they're looking to implement going forward, right?
Being looked at by New York State to think about whether it's a model that can be achieved at scale, which is really wonderful. Health First is also collaborating with our own community organizations, especially in Brooklyn, to think about how elements of this community health worker component can become realized at scale, which is really exciting. And one other outcome of the study that I really want to share is that not only does this look good in data, the women in the study, about 92% of them said that they found the education extremely helpful. 92%, I believe, also reviewed this information with their partners. So it was even more support than just the community health workers. And 99% of it found it helpful. So this is also about improving the experience of care, because people who have lived through systemic racism and implicit bias, they do need that extra support in order to achieve better outcomes.
I love that.
Can I ask something real quick? Because I want to say, Rush said, I want to thank you all for the important work you're doing, because in order to make progress, it's going to take
everything
from different facets coming together. Advocates like Jessie, media powerhouses like Angela Wright, private sector folks. But I want everybody to really tap into this, and I really want to involve the chat a little bit. So if you're in this, if you're tuned in right now and you've experienced an instance of medical negligence, racism, medical neglect, please just drop a heart, any color, in the chat right now. And I want to watch this thing light up, right? Because
it light up.
It's so common. People are having this, but these conversations are isolated, because what happens in our country, Angela, is that particularly birthing experiences, but more so medical experiences, are siloed, and they are
marginalized.
They're marginalized. But what happens
polarized.
Is polarized, but beyond that, they become transient, meaning that whatever happens in the hospital, it stays in the hospital. And we get home, we go on with our lives, and we're not hearing these women that are having these near misses. And like we said, in addition to the almost 800 women that are dying every single year, there are more than 50,000 women that are experiencing what are called near misses, like I said. And but they're not understanding that not only does this happen to them, but the woman across the street, the woman across the cubicle, is having the same one. And so what we're seeing now with this maternal health revolution, this maternal wellness revolution, is that women are beginning to raise their voices. They're beginning to share their stories. And by doing that, they're empowering others to do the same, which ultimately puts pressure on organizations. It puts pressure on politicians. It puts pressure on the private sector when people are raising their voices, saying enough is enough.
That's
and we're tired of it. So people are coming to the table in more meaningful, more significant ways than they ever have before. And so that's why we're so hopeful that we're going to turn this thing around.
Right. If I could just drop the final rallying call to actions, because I know we want to be respectful of your time, Angela. I know you have another meeting.
Because I just wanted to say that I'm reading everybody's comments on here and everybody's different stories of what they've gone through, what their friends have gone through, what their wives have gone through. And just stories really shows you, just from the people that are watching on the live, just how prevalent this issue is, which is why it's something that has to be addressed. And so I do want to thank you guys first and foremost for even taking the time to do this today.
Thank you so much. Angela, you're going to make me cry thinking about how much support we get from you. So rallying actions. 1, sign the petition at 4. Number 4, Kira. Number 4, moms.com. Please follow Charles, please, so that we can advance this Momnibus Act. Second, I actually put all these takeaways together in something I call the Black Maternal Health Survival Kit, so that you can download it with the notes. So in case you weren't able and you want to share it with someone, you can sign up for it at thedetoxnow.com/gift, because I want to make sure you have the Earth app information, the petition information, the notes about Health First, because the other thing we forgot to say is that, being pregnant is actually a life event that you qualify for Medicaid, actually for for healthcare where you can enroll. But then also the thing about the year postpartum coverage is actually available now, right? Is that what you said, Rashi?
So New York State just passed that,
it just got passed.
Days postpartum, now 1 year. So that would be taking.
So now it's 1 year. It just got passed. And,
Yep.
And the final call to action. So check out Health First if you want to learn some more at healthfirst.org, and then download the Earth app, please. We need that information. We need that data so that we can be empowered to know. It was like, what I call it is like the green book of pregnancy, the green book of birth. Remember in the civil rights movement, the green book was like the hotels that we could stay at, the gas stations where we could get our gas, right? As people, as Black people. Well, we need to know what doctors are going to fight for our health. We need to know what places that are damaging to us, okay? So that we have that data, and there's more accountability that also empowers the compliance that Charles was speaking of.
Absolutely.
Very important.
And you can see the app here in these comments too.
Yes.
IH. That's the name of the app.
It's Earth is birth it's birth without the bias. I said it for you, Kimberly.
And like Danny Nicole, I see your story right now. She said, I felt pressure during birth. If I hadn't stressed that something was wrong with my baby, would have died. The blood clot was blocking the birth canal. She wasn't breathing when delivered. And grateful was assisted to breathe. And now she is 6 years old. Thank God.
Oh, thank you for sharing that story. See, that's why we do this. That's why we do this. And the last thing I forgot to share is that we're actually launching our first, at the Detox Now, our first prenatal supplement. It's gonna be out by the end of the day. So I'm excited because we're just trying to create more and more ways, holistic, all natural, organic, to empower our people to take charge of our life, and to fight, and to not to just be fighting for our lives, but to achieve and live health equity, right, Charles? It's like to actually achieve it, live it, and make it a norm, make it the new norm.
No question.
So thank you so much, Angela. We love you.
For anything to, just like Jesse knows, you just let me know if there's anything I can do.
I really truly appreciate you, sister, and not only just today, but everything you stand for. We're grateful for you. And like I said, this movement would not be possible without the support of people like amplify these stories, right? And have shared them so that they become part of the greater collective consciousness and the conversation. So we're grateful, truly.
All right. And thank you, Rashi. I'm sorry for these technical difficulties, but we appreciate you so much. We got to...
We're good. We're really happy that it happened. Thank you so much.
Thank you.
All right. Have a great rest of the day, everybody. Thank you.
Thanks for watching.